So in Lesson 5, we're going to discuss coding. I know coding is probably one of the more intimidating subjects for medical billers, but it's really not something to be feared. It is complicated and complex, but don't be overwhelmed when you hear discussion of medical billing codes and diagnosis codes and treatment codes. There are two primary types of codes used for physician billing. Those are the diagnosis codes, which describe the condition of the patient, and there may be multiple diagnosis codes assigned with one visit with a physician. There are also treatment codes, and these are used to describe the treatment or the services performed on the patient to treat the conditions identified by the diagnosis codes. Coding, like I mentioned, it's very wide and it's very deep. There are unique codes for every specialty, but many specialties use the same codes and the same modifiers several times commonly. So codes are kind of a shorthand method that are used to describe the conditions of a patient and the treatments applied. Just wanted to give you a brief overview of what codes are used and how they are related. Let's get into diagnosis codes a little bit. ICD stands for the International Classification for Diseases, and ICD-10 are the diagnosis codes that are currently used to diagnose a patient's condition. The ICD-10-CM is for outpatient services, and the ICD-10-PCS is for hospital billing. We do have a chapter on hospital billing, but we will primarily be talking about the ICD-10-CM in this chapter, so we'll abbreviate that with just ICD-10. ICD-9 was the previous revision, and you may still see claims and documentation with a lot of ICD-9 references. But ICD-10 codes are 7 characters, and they are much more descriptive than the old 5-digit ICD-9 codes. The Center for Medicare and Medicaid, CMS as it's abbreviated, requires all claim submissions after October 15th of 2015, which is almost 2 years ago when I'm recording this, to use the new ICD-10 diagnosis codes. Treatment codes. The procedure codes or treatment codes are used to document the services performed by a healthcare provider on a patient. The federal government established the Healthcare Common Procedure Coding System, that's abbreviated as HCPCS. That sounds out as HCPCS, so if you ever hear the term HCPCS, that's what that means. But HCPCS was established years ago for Medicare, and it's been adopted by the insurance industry ever since. There are 2 categories of procedure codes defined by HCPCS. There are Level 1 treatment codes and Level 2 treatment codes. The Level 1 treatment codes are the current procedural technology. You see those as CPT-4 codes. These are 5-digit codes, and these are most commonly used in physician-patient encounters in a physician office setting. These are the treatment or procedure codes that medical billing is most concerned with on the CMS 1500 forms. Now, CPT codes are maintained and copyrighted by the American Medical Association, the AMA for short. The -4 represents the current edition used. The Level 2 codes are maintained by the Centers for Medicare and Medicaid Services, and they are for non-physician services and supplies that are not covered by the CPT-4 Level 1 codes. The Level 2 codes are composed of a single letter, and they range from A to V, and they're followed by 4 digits. You see those also more in inpatient type settings like in hospitals. Treatment code modifiers. CPT codes have a 2-digit alphanumeric modifier that's added on the end of the code. So an example would be like a 99203 that's used for an initial office visit. You might have a modifier on the end, a -57 for this example, that indicates a decision was made for surgery at this visit. Modifiers are used when a procedure is performed differently than what was described in the normal 5-digit code, and they will typically indicate that it was performed by more than one physician, that it has a professional PC, you'll see that commonly, or a technical TC component, that the procedure was performed more than once, that it was a bilateral procedure. That means it was either left side or right side, that only part of a procedure was performed, or that a procedure was increased or reduced. Where these codes are used, these are some examples electronically and on the paper where these treatment and diagnosis codes would be used. The blocks in the electronic practice management form correspond to the blocks on the paper form, but I don't know how well you can see this, but there are locations for the diagnosis to be entered, and the corresponding treatment codes and dates of service would be entered lower in the what they commonly refer to as the block 24. So takeaways for coding: a medical billing specialist needs to become familiar with the most frequently used procedures and diagnosis codes for their specialty. They need to keep abreast of any coding changes or payer policies for a particular specialty. You want to remember too that the goal of good coding practices is compliance and fair and accurate compensation for the provider for their services performed. I'd recommend searching the AAPC coding forums for your particular specialty, because there's a wealth of information there from people that have already many times encountered the same problems and issues that you have. You can just search AAPC forums and they'll bring you right to it. And I'd recommend using online coding services such as Find a Code or Supercoder. Those have been really valuable for us in finding and solving coding issues quickly, and there's a wealth of information. Any online coding service can provide you that. So that concludes Lesson 5. Next we'll be talking about claim creation and submission.